Good morning. Today we'll discuss about the joint called Atlando-occipital joint. So Atlando-occipital joint is a joint which communicates the skull with the vertebrae. So name itself, Atlando means atlas, which is the first cervical vertebra, and occipital means occipitum, which is the part of the skull. So Atlando-occipital joint, it communicates the skull with the vertebrae, and thus it transmits the body weight. Okay. So the type of the Atlando-occipital joint is a synovial joint, and its variety is ellipsoidal variety. And the articular surfaces involved in the Atlando-occipital joint are above convex part of the occipital condyles and below concave superior articular facet of the atlas bone. Okay. So the basic anatomy of atlas bone. So the atlas bone is the first of the 7 cervical vertebra. Okay. So it supports the weight of the skull. Okay. The markings of the atlas bone, it having various markings, and this image shows the atlas bone, and in that the bluish color is the superior articular facet, and these articular facet will join with the occipital uh, occipital bone. So this is the occipital bone. So the ligaments. So the ligaments present in the Atlando-occipital joints are fibrocapsule, anterior Atlando-occipital membrane, postero-Atlando-occipital membrane. Okay, so these are the ligaments which contributes the Atlando-occipital joint. So the blood supply for the Atlando-occipital joint are the vertebral artery. So vertebral artery, Y means the atlas forming the articular surface for the Atlando-occipital joint. So it's a first cervical vertebrae. So the vertebral artery supplies for the Atlando-occipital joint. So as well as the nerve supply, so the atlas is the first cervical vertebra. So that the cervical nerve, that is the C1 nerve, which supplies for the Atlando-occipital joint. So the movements present in the Atlando-occipital joints are ellipsoidal joint. So that it provides or it produces the flexion or extension, that is the nodding movement in the transverse axis, and also lateral flexion, which will be takes place in the anteroposterior axis. So the muscle producing the movements. So for the flexion, the muscles involved majorly longus capitis and also the rectus capitis anterior. So for the extension movement, so the major muscle involved are rectus capitis posterior major and minor, and then the oblique capitis superior, then semispinalis capitis, splenius capitis, and also the trapezius. For the movement lateral flexion, the muscle involved are rectus capitis lateralis, semispinalis capitis, splenius capitis, sternocleidomastoid, and then the trapezius. So these are the muscles which is responsible for producing the movement of various movement present in the Atlando-occipital joint. Okay. So the Atlando-occipital joint summary, it comprises of a pair of the lateral Atlando-axial joints, that's a plane joint, and which is between the inferior facets of the atlas and the superior facets of the axis. So a medium Atlando-axial joint, that is a pivot joint, so between the dens and then the anterior os and then the transverse ligament of atlas. So similar to the Atlando-occipital joint, the Atlando-axial is the combination of first cervical vertebra and then the second cervical vertebra. So first cervical vertebra called as the atlas, and second cervical vertebra is called as the axis. So these both combinedly articulating together to form the Atlando-axial joint. So this is the part of the axis bone. And then this axis bone in superior view, there's a major process called this one is called as the odontoid process, and this odontoid process should be placed anteriorly, and these both are called as the articular facet. This superior articular facet articulates with the inferior articular facet of the atlas bone to form the Atlando-axial joint. Okay. So this one is called as the Atlando-axial joint. The superior to the Atlando-axial joint, which one is called as the Atlando-occipital joint. So this one is the occipit. First cervical vertebra is the atlas bone. Second cervical vertebra is called as the axis bone. So these two surfaces forms the Atlando-occipital joint, whereas these two surfaces forms the Atlando-axial joint. So the ligaments are capsule, anterior longitudinal ligament, ligamentum flavum, then capsular ligament, and then transverse ligament. So the movements present in the Atlando-axial joints are all three joints produce rotatory movements around a vertical axis, and the movement is limited by the alar ligament. So the muscles producing the movement are rectus capitis posterior major, obliquus capitis inferior, splenius capitis of one side or along with the sternocleidomastoid of